From infancy to adolescence, from prenatal care to safe motherhood, we discuss it all. Maternal health, vaccinations, infant nutrition, preventive care, mental, physical, and emotional wellness of both the mother and baby. We talk about what truly matters here. Tune in to Sunny 88.7 FM and also on Sunny TV every Friday morning from 9:30 a.m. to 10 a.m. Also a repeat broadcast on Saturday morning from 9:30 as we bring to you the Cradle to Crayon Show. Join me and my team of doctors and health experts as we answer your questions, give you expert advice, clear all myths, and also share real solutions. Remember that informed parents raise healthy children, and healthy children build a stronger future. See you. From infancy to adolescence, from prenatal care to safe motherhood, we discuss it all. Maternal health, vaccinations, infant nutrition, preventive care, mental, physical, and emotional wellness of both the mother and baby. We talk about what truly matters here. Tune in to Sunny 88.7 FM and also on Sunny TV every Friday morning from 9:30 a.m. to 10 a.m. The Cradle to Crayon Show right here on Sunny 88.7 FM. We are live across the world on www.sunnygh.com. We are also live on our Facebook pages. Check out Cradle to Crayon Facebook page, Sunny, and then Sunny TV and Sunny FM Facebook page. We are live. Join the discussion. Let's have a good time. Also, we are on TV. Those who are home, watch with us, and then let's learn one or two. We say thank you to our sponsor, Back Specialist Hospital and Fertility Center. And the course of the show, as we do every time, we'll open our phone lines. Now, this morning, we want to look at something that many people experience, but often we just ignore it. From the long hours of sitting, from the high demands of pregnancy to childcare, the just everyday stress, we want to look at low back pain. Our question this morning is, when do we actually consider this as serious? When we experience a normal pain, when should we seek medical attention? How do you prevent and manage this condition effectively? I have here in the studio doctor from Focus Orthopedic Hospital. He's a neurosurgeon. He's been here 2 years ago. We had him here, and yes, he's back again. The person of Dr. Kwejo Poku Yankee, we're discussing low back pain. Dr. Yankee, good morning.
Good morning.
And Happy New Year.
Happy New Year to you.
It's good to have you back here.
Thank you very much.
Great,
it's a
great.
pleasure.
Yes. So low back pain, what are we talking about? What exactly is it?
Thank you very much. I think I will have to start off by explaining what exactly
Great.
the lower back is.
Great.
And I'll start by saying that the lower back, mainly we are referring to the lower aspects of the spine, what we call the lumbar region, and also part of the pelvis, because the lumbar region fuses with the pelvis. So generally we have 5 bones in the lumbar region. Most of the time we have 5 bones in the lumbar region, and in between the main bones we have what we call disc. So these are like cushions which prevent one bone from sitting on another. Because if one bone sits on another, that is going to generate.
Is it what's called a cartilage? Or that's different?
Yes, that's a disc. Yes.
Okay.
So so that prevents one bone from sitting on another, which will generate pain. But of importance or of interest is that within the bony structure, that's where we have the nerves. These nerves, so essentially they carry information, the way we feel to the brain, and then also help us to be able to move, to feel, to control urine, control toilet. Everything is coming from the spine.
Okay.
And then as you can see, the spine, it's within the bony, there's a canal within the bone, and that's where the spine runs. So generally, if you're going to have pain, it's either there is something going wrong in this structure or where it articulates with the rest of the pelvis.
Okay.
Most of the pain we have, we can go on and talk about, most of the pain we have for the older people is just because there is what we call degeneration. It's wear and tear. So the discs, with aging, there is some wear and tear of the discs. The bone also wears out, and then that's what generates pain.
Okay.
But not only that, sometimes you can have a disc which pushes out. Maybe you are bending to lift a heavy object, you didn't bend properly, or you're engaged in sports, or there is trauma. The disc can push back, sit on your nerve, and then that can generate pain. Usually low back pain doesn't come alone. Usually it may be associated with pain which runs down the lower limbs because the nerve is being compressed. In the severe form, because these things control urine and toilet, you can have urinary
Oh,
problems.
your back actually controls that.
The nerves which
The
run.
nerves, okay.
Yes. So, like I mentioned, there is a canal in the bony structure.
Okay.
And then there are nerves there. The nerves, they come out through these spaces
Okay.
in the bone. And then these nerves, they go to supply the muscles in the lower limbs. They go to control the sphincters for urination and then for bowel movements. So if there's a problem with the nerves, you can have problems with your urine control and then the bowel control. In addition to feeling
numbness,
feeling numbness
okay,
or proper pain. If it's very severe, you can actually become weak in your lower limbs.
Okay. Is lower back pain very common?
Yeah, it's a very it's a very common symptom.
Okay.
I mean, I think almost everybody at one point in your lifetime you have some low back pain. We believe that the prevalence is almost like 90%.
90%.
Yes, 90%.
Okay.
Yeah. So it's a very common symptom.
Okay.
And a lot of people who come for excuse duties and the rest, it's just because they have low back pain. Yeah. So it's relatively common.
It's common.
Yes.
For children, do you see it often in children? And when they do, how different is it from what adults experience?
Okay, so low back pain in children is not common.
It's not common.
It's not common at all.
Okay.
So if you have a child who has low back pain, it should be of concern to you, and you need to have it addressed in the hospital. So for children, what gives them low back pain is very different from what happens in adults.
Okay.
It may be they've had trauma, they fractured the bone, or sometimes the bone didn't form too well. There's a slippage of the bone. I mean, what gives rise to low back pain in children is very different.
Okay.
So if you have a child who has really low back pain, I mean, he needs to be seen and then adequately investigated to know what is giving rise to the low back pain.
Okay. What if, occasionally they will come in and say, my back is paining me, massage my back. Is it normal?
That's okay.
That's fine.
That's okay.
Okay.
Yes.
Okay.
But if the child complains of significant pain, it's not going.
Okay.
I mean, it needs attention.
Okay. What actually causes this with the pains, even when adults? What causes the low back pain?
So like I mentioned, a lot of it has to do with, let's say the commonest cause of low back pain in the adult population, we call it mechanical pain. And it's just because you are straining the muscles which hold the bones in the lower back, the muscles, the ligaments, you are just straining them. And that's what gives rise to the low back pain. That is the commonest cause of low back pain in the adult population. Majority of the time when you try to investigate, really you may not find anything anatomical at all. That's about the commonest thing. But that is not the only cause of low back pain. Like I mentioned, in patients who are older, it's from wear and tear. Aging.
Okay.
So just aging, say degenerative disease. So mechanical pain, degenerative disease. And I mentioned that sometimes you can have the discs, the cushion in between the bones. It can wear out. If it wears out, it will give you, it can give you some low back. But of importance is that if it's a bit of the disc pushes out and sits on the nerve which is coming out from the foramen, then it can give you pain going down the lower limb.
Okay.
These are usually the common causes, but these are not the only causes of low back pain. Majority of the time it is these ones, but there are other causes of low back pain which really are very important. So you can have low back pain, I've mentioned trauma. So if you have significant trauma to your back, either you fractured your spine or the disc is ruptured, it can give you low back pain. And then we have low back pain which can come about as a result of tumors in the spine.
Okay.
Tumors are abnormal growths in the spine. It can be a primary tumor, like something which is originating from that part of the lower back, or it can be a tumor which is originating from another place. So let's say in men, you can have prostate cancer, and it can spread to your lower back, and it will give you low back pain. For females, breast cancer can spread to the back. It can spread to the chest wall, the spine. It can go all the way and involve the whole spine. We can have patients who have like thyroid cancers can spread to the spine, or kidney problems, tumors involving the kidney that can also spread to the spine. So for anytime you see patients who complain of low back pain, and they are usually older, we are very particular. We really want to be sure that it is not a malignancy or a cancer which is spread to the spine. So we'll always ask you questions to be sure that it is not from any of these things. Yes.
Okay. Now I'm looking at posture. How is posture important in this? Because for people who lift heavy things and then even sit for long hours, sometimes you get to work 8 a.m., you sit till 3:34. Does it have any impact?
It does. It does. Yes. So posture contributes a lot to what we mentioned as mechanical back, because you strain your back a lot. And you must remember that when you are sitting, the lower back is what is carrying the rest of the body. Your whole weight is sitting on the lower part of your spine. So if you are sitting and you're loading the back a lot, at some point it to begin to hurt. So we don't want you sitting unnecessarily for too long. Again, when you are sitting, the way you sit is also important. When you sit, we want you to really support your back well. So you don't sit and then without any back support, otherwise your back will hurt you. So you sit. For those who sit for long periods and the rest, we advise that maximum 1 hour, 1.5 hours, you get up. And then stretch yourself a bit and then come back. Yes, posture, that's what, and then you really need you shouldn't sit in an asymmetric way. The load should be well balanced in the lower back. It shouldn't be sitting and then your chair is not too good.
Okay. How about sleep positions? Sometimes you sleep, you wake up and as a Monday so there's a pain on the back and all that.
Okay, I know. Okay, so sleep is an interesting, because we get these questions all the time. So in order not to really distribute your weight symmetrically, well, it is said that it's preferred you lie on your side. You get a good pillow and your spine is straight. My own opinion is that's the best. If you can lie on your side, your spine is straight, you're not loading your back, yes. But sometimes it can be difficult to do that all the time. So I say that, well, whatever you feel comfortable with, it's okay. But sometimes you sleep in a particular, you can sleep even on your side and then wake up and you still have some pain. Yes. But it's particularly the sitting position which are of concern.
Okay. In your submission, you made mention of women maybe when they have breast cancer. I realize that during pregnancy, it's actually an issue. Why is that with back pain?
Okay, so, well, thank you. So, during pregnancy, the body is fashioned such that, when you are pregnant, you gain weight. So again, you load your lower back. So there is more stress over the lower back. And then, because of the pregnancy, because of the additional, the way the spine is balanced, you become most of the time you become imbalanced. But the spine is such that, the neck region, if you put together the neck region, the thoracic or the middle part of the spine, and then the lower back, when you're standing straight, the center of gravity should go through just in front of the sacrum.
It's not balanced.
Yes, but once you become pregnant, your center of gravity changes.
It shifts.
Yes, because you have the fetus in front of you, so you tend to the center of gravity tends to go forward. And that puts a lot of stress on the lower back, in addition to the weight that you gain and then the stress that you put on the lower back. Yes.
Okay. Well, it's just 30 minutes at top of that. I have here Dr. Pokuyanki. He's a neurosurgeon with Focus Orthopedic Hospital. We're discussing low back pain. We say thank you to our sponsor, Back Specialist Hospital and Fertility Center. Visit them for all your fertility, maternal and general health concerns. Their services include IVF, IU and other fertility services. They do child health and pediatrics, women's health and gynae, obstetrics and maternity, internal medicine, general OPD care, inpatient care, the surgical service, that's both general surgery and also plastic surgery. They do theater service and also laboratory and ultrasound scan service. Visit them right here in Accra, they are in Taifa, or call them on 0558 862 292 or 0592 196003. Back Specialist Hospital and Fertility Center, integrity and excellence in health care. Yes, our phone lines have been open. Number to call is 0540-130-684. It's the same WhatsApp line. Do that, and my doctor here will answer. You can also drop us a question on Facebook. In whichever way, my doctor will answer you. Dr. Yankee, I want to find out, at what point should we consider this as serious? Because, okay, like I'd mentioned, once in a while your kids will come, my back is paining me, massage me. When the woman is pregnant, is there. You lift heavy items. I mean, your job demands that you do that. When do we draw the line and say that this is going beyond the normal? You need to seek professional help.
Okay, so thank you. So generally, low back pain, I must say majority of the time, probably the low back pain will go by itself.
It goes by itself.
Yeah, let's say you give yourself a month. Majority of the time, this pain will go by itself. If the pain persists beyond a month and the pain is progressive, of course, you need attention. And then you must also pay attention to what is associated with the low back pain. So if, let's say, you have low back pain, we tend to call these the red flags of low back pain, because these are signs you have to look out for when you have low back pain. Let's say you have low back pain, in addition, you're losing weight.
Losing weight.
Yeah. I mean, something it should make you think that something is not correct. Or you have low back pain, is associated, if you are losing weight, like I mean, sometimes it may be associated with some form of cancer. It may. We have to actually investigate it to be sure. Because if it's a deliberate weight loss exercise you are doing, that's different.
Okay.
But unexplained weight loss, with low back pain, you need attention. If you have low back pain and it's associated with temperature, fever, it could be that you're having an infection at the back, and that needs an urgent attention. You have low back pain and it's associated like weakness in your lower limbs, because you can have low back pain, the nerve is so much compressed that you become weak in the lower limbs. That needs urgent attention. You have low back pain and you have associated urinary problems, like you can't control your urine, or you've gone into retention of urine. You need to be concerned. Yes. Or low back pain, you have associated constipation. You need attention. I mean, constipation is interesting because a lot of times when we are constipated, we say, oh, maybe I ate some food. And your mind, you may never think about it. But if you have low back pain, associated constipation, or urinary symptoms, it's something. We are not saying there is something there, but you just have to come for attention. So I mentioned, yes, and of course, if you have trauma and you have significant low back pain, yes, these are things you have to seek attention. Okay. And of course, if you, let's say, you are known to have some form of malignancy or cancer, maybe
it will come with the pain.
Yes, it can, and you have pain at the back. It may just be that the disease has spread to the spine. And you need to come and then for us to check it out.
Okay. Once they come in and you've evaluated, you've done your tests, I'm sure you do scans and all that, you've confirmed this. Which options are usually the ones that you go for treatment?
Oh, for treatment. Okay. So aside so I said that there are the ones which need urgent attention, like infection, trauma, whether it's a malignancy. These ones need urgent attention. But majority of the time, like I mentioned, low back pain, we try and then manage you conservatively. Yes, so conservative, we can maybe give you some medications, some anti-inflammatory medications. It really depends on what is going on. Let me see.
As in the cause?
Yes.
Okay.
So when you come in, we'll assess you, examine you, check everything out. If it's not too long, we may actually not ask even for an X-ray if we think it's just mechanical back pain. Like I mentioned, we expect that within a month it should resolve. But if it persists, then we can go on to do X-rays. X-rays are good at looking at the bones and then the alignment of the spine. And then if something is wrong, we'll be able to tell from the X-ray. Sometimes the ligaments, the things holding the bones have become weak, and then it allows one bone to
rub against each other.
Rub against or displace. One bone may be displaced over the other. Yes, and that can give you pain. Fair enough. We know how best to treat it. But apart from X-rays, if it's necessary, we do what we call an MRI. So MRI is good at looking at the soft tissue, like the nerve, the discs. If there is anything, there's a disc problem, we'll get to know. If there is the ligaments have become so big and are compressed on the nerves, we'll get to know. So really, our treatment will be tailored towards what we think the problem
Okay.
is.
What is the root cause
the
of the
root
issue?
cause
Okay.
of the issue is.
Okay.
But sometimes you may just need some medications. Other times we will ask you to do physiotherapy.
Physio.
Yes. Other times educating you, letting you know exactly what the problem is, and reassuring you is very important. And then some people have to do adjustment to the activities.
Okay.
Yes. So
Okay.
mention
Adjustment as in due to your lifestyle.
yeah, lifestyle
factors you
adjustment.
need
Yes,
to.
yes,
Okay.
yes, of course, yes. So you're setting the way you pick up, you carry objects from the floor, the way you get out of bed. We can do all these. We advise you on all these adjustments, and then hopefully we watch you and see. But if, let's say, there are instances you may need like surgery to fix your back.
Surgery
If it-
can come in.
Oh, surgery can come in.
Okay.
Yes, surgery can
Okay.
come in. Yeah, but if it's necessary to fix your back, we'll
You
let
would
you
do it.
we'll let you know.
Okay.
But for cases like degenerative disease, mechanical, we try very hard to manage you non-surgically
Okay.
until
Okay.
we really think that you've gone beyond conservative treatment. Then we can advise on surgery.
Okay. Okay. Now I have this question. It's coming from Aaron. Aaron, it's been a while. Say good morning to Madam Abigail. How do we manage low back pain at home? At home. Yeah.
Okay. Okay.
Yeah.
All right.
Yeah.
Okay,
There's a
so-
second one talking about preventive strategies for low back pain, which I think we'll take later. But let's look
Okay.
at the
Okay.
management at home.
At home, well, I think a lot of it has to at home. A lot of these things have to do with the body mechanics or the way you go about your duties at home. I'm not too sure whether you have the video, but how you even lift objects from the floor. Whatever you do, you always want to keep your back straight. It's something we should remember. We cannot teach you everything, do this, do that, but whatever you are doing, try and keep your back straight. So when you're sitting, you have a back support, your back is
So you
straight.
don't bend your back.
Yes, so bending is not too good for
Okay.
the back.
Okay.
Yes. So if, let's say, you want to pick something from the floor, it's better you bend at your knees, keep your back straight
Consciously.
consciously. If
Okay.
you're not conscious about it, you won't.
You get
do
it wrong.
Yes, yes, yes. So you bend at your knees, and then you pick up the object, and then you come up. So that's, and then sitting, like I mentioned. You sit straight. At home, well, weight loss is always it's a good thing. Like not being overweight or obese, because the heavier you are, the more load you put on the back. Yes. So if you put too much weight on the back, your back is going to really hurt you.
Okay. Okay. Okay.
Mhm.
You know, I read about strengthening your back. I don't know whether it's the same thing you talked about.
Yeah.
Okay. What exercises usually would you add? Is it something we should do on a regular basis or when you complain of a back pain?
Oh, I think you should always. So all these things we are doing, you're trying to strengthen the core muscles.
Okay.
Yes, and it's something. It's something you should do to strengthen, because these are the muscles holding the spine. So if the muscles become weak, then you tend to have a pain at the back.
Okay.
Yes, so it's something you should.
Okay. So I have this question here. It's from Joanna. She's saying that I like wearing high heels. I've been doing that for some time now. Should I be worried? Yes. Should she be? I think it goes to every one of us. Should we be worried?
Wow, that's interesting.
And for how long do we wear it?
Okay, wow. That's an interesting question. But, like I mentioned, getting your balance, getting your center of gravity, getting it. So generally, when you're standing, you want your center of gravity. If you should draw a line, you want the center to go through the pelvis, go through like this part.
Okay.
It's not something you will see. Yes. If you wear the heels and it makes you push forward too much, then it's really not the best. Yes. It's really not the best. So I would say that if it's very likely that when you wear the heels, you'll be tilted a little. Otherwise, you have to consciously straighten up.
Okay.
Yes, you have to consciously straighten up so that you don't get an imbalance in the way the spine is.
That will help.
Yeah, that will help.
Okay.
Yeah.
Okay. And then when our kids, when they are going to school, their school bags are like suitcases on their back, always carrying the heavy books, complaining, taking all their books to school every day. Does it really have any impact on them?
Of course. I mean, you are loading the back. It will have an impact on.
It will have an impact
it will have an impact on them. Yes. So, and then the thing to do is, when you are even carrying the bag, we prefer that sometimes what you do, you put just one strap on, maybe the right
and
shoulder,
then leave the other one,
or leave the other.
Yeah.
Make sure that the load is balanced over the shoulder. So you put both straps there. Then the back carries the load. The load is well distributed at the back rather than. But of course, if you're carrying a lot of weight at the back, you just have to remember that everything you are doing, you must remember that you're loading the back. And when you talk about degenerative, it's not something which happens in a moment. It's something you've been using your back from childhood.
Okay.
And you've been straining it for a long time.
Okay.
By the time you are 60, all the effects of loading the back will come to bear. And that's where you begin to really experience these changes at the back, and that's what gives you the low back pain.
Okay. So this other question is saying that, do waist trainers help or worsen the back? Waist trainers, or maybe corsets.
Waist
trainers or corsets. Sometimes we wear this girdle tight one. Yeah. Does it worsen it, or it really have no effect on it?
Okay, we have hospital. Well, I know females have corsets.
Yeah.
That's just okay. So let me just say that when you use a corset for a long time, sometimes the muscles become lazy and weak.
Lazy?
Yes, because the muscles must be active. You must always move the muscles. So if you don't use your muscle for a long time, you see that the muscle bulk itself becomes small.
Okay.
So we always want the muscles to be exercised.
Okay.
We do use corsets in the hospital.
You do?
We
the normal ones that the women wear, that's different.
I think no, it's different.
It's different.
Yeah, because we have corsets with some bars inside to help support the back.
Okay.
And we use that for a purpose.
I think I've seen one that they wear at the back. It looks like a bag.
That's a brace.
That's brace.
That's
okay.
a brace. Well,
that's also to support your back?
Yeah, that's to support the back.
Okay.
But, a brace corset, they all braces.
The same thing.
That's fine. But I'm sure what you're talking about comes up to the thoracic region, the upper part of the spine, and then the lower back. Okay. So, though corsets are good, you need to also exercise your muscles. So at some point in time, you have to take it out and then exercise them. We use in the hospital, especially if we think that there's so much excessive movement between two or more bones.
Okay.
Sometimes the bones move too much, and then when it does that, it gives you pain.
Okay.
So we'll give you a corset so that we prevent the excessive movement of the two bones, and that lessens the pain. But even for that, we don't say that you wear it forever. The muscles must be exercised, otherwise you lose the muscle tone, become lazy, and that itself can give you some pain. Yeah.
Okay. Our time is up already. Your final words for those listening to ease the pressure on our back. You had mentioned that you need to reduce your lifestyle factors. So for people whose work involves lifting heavy objects, you need to sit for long hours. How do you manage this?
Okay, so so we say that you must learn how to lift things properly.
Don't bend your back.
Don't bend your back.
Okay.
Bend at your knees. Whatever you're doing, just remember to keep your back straight. Okay, don't put on too much weight. Especially if you are things which involve vibration, whole body vibration, like you're driving, the road is bad.
Okay.
Yes.
Sometimes you can't avoid it.
I know. So you drive slowly.
Slowly, okay.
So you drive slowly so that the stress on the back is eased. Yes. And then if you have back pain which persists more than a month, mommy, you need to seek attention.
Need to come in. Okay.
And then you remember the red flags we talked about. Pain which is associated with unexplained weight loss,
high temperature.
Yeah, temperature.
Okay.
If you have a malignancy already,
okay.
Bowel bladder function, it's affecting your urinary function or your toilet function. these are things you need to seek attention at the hospital.
Okay. Thank you so much.
You're
Thank you
most welcome.
for coming. I'm sure we'll have you back another time.
Sure.
Yeah.
All right.
And then thank you to all those who listen, those who watch on Sunny TV. Don't forget, same time tomorrow, we'll have a repeat broadcast on Sunny TV. And thank you to our sponsor, Back Specialist Hospital and Fertility Center. Have a good working day and enjoy your weekend. Bye-bye.
Bye.
Lift up your spirit.
From prenatal care to safe motherhood, we discuss it all. Maternal health, vaccinations, infant nutrition, preventive care, mental, physical, and emotional wellness of both the mother and baby. We talk about what truly matters here. Tune in to Sunny 88.7 FM and also on Sunny TV every Friday morning from 9:30 a.m. to 10 a.m. Also a repeat broadcast on Saturday morning from 9:30 as we bring to you the Cradle to Crayon Show. Join me and my team of doctors and health experts as we answer your questions, give you expert advice, clear all myths, and also share real solutions. Remember that informed parents raise healthy children, and healthy children build a stronger future. See you.